presenters from the American Indian Cancer Foundation. Our first presenter is going to be Amanda Dion, and then we are going to have Donis Chosa. Oh, Donis Chosa. So we're going to start sharing the screen now. Perfect. Take it away, ladies.
And I'm just, maybe if you could put yourselves on mute, unless you have a question. There's a chat box as well if you want to ask some questions to the group or individuals, but during the presentation, just to reduce the background noise, keeping yourself on mute. Okay, go ahead.
All right.
Good afternoon, everybody. My name is Amanda Dion. I am an enrolled member of the Northern Cheyenne Tribe and also a descendant of the Turtle Mountain Band of Chippewa Indians. I am a prevention and policy coordinator here at the American Indian Cancer Foundation, where I've been in my role for the past 4 years and have worked among this team to develop culturally tailored tribal health equity resources, and as well as policy system and environmental change tools.
Okay, so my name is Donis Chosa. I've been at the American Indian Cancer Foundation for over 4 years. I'm the prevention and policy specialist here, working alongside Amanda and our prevention and policy team. I'm originally from the Keweenaw Bay Indian community located in the Upper Peninsula of Michigan. But currently enrolled in the Bois Forte Band of Chippewa, which is located in northern Minnesota. And I hope you enjoy these pictures. These were actually taken in California just last week near Palm Springs. We were there for a work convening. So we'll jump right into it. So during today's webinar, we'll be able to what we want to do is be able to get you all, the participants, to understand PSE change through an Indigenous lens. We want you to be able to identify areas where PSE work can be applied to create sustainable changes in our communities, and the differences between PSE change solutions and other common approaches through an engaging online activity. Next slide, please. So first we'll get into the ACAF story and a little bit about our team. ACAF is a national nonprofit that was established to address the tremendous cancer inequities faced by American Indian Alaskan Natives. We were founded in 2009 and became operational in 2011. Our mission is to eliminate cancer burdens on American Indian families through education and improve access to prevention, early detection, treatment, and survivor support. Next slide, please. Oh, you got it. So our vision is a world where cancer is no longer a leading cause of death for American Indian Alaska Natives. We believe that through hard work, culturally appropriate, community-based programs, and policy change that affords Native people access to the best prevention and treatment strategies, we believe that we'll see a day where American Indian communities are free from the burdens of cancer. So our prevention and policy team, as you can see below, there's 5 of us. We partner with American Indian and Alaska Native communities to implement policy systems and environmental change strategies to promote healthy norms, health equity, and also cancer prevention. We focus our efforts mainly on tobacco, physical activity, and along with healthy eating. More specifically, our prevention and policy team assists in efforts such as community engagement, focused conversations, action planning, coalition building. We also do on-site and in-person training, as well as distance support or web-based support, such as this webinar we're doing here today. We've created several tools and resources that we like to share with our Native communities who are willing to do the work. And then some of these tools and resources we'll talk about later and how we utilize them. So we have PSE infographics tailored for tribal communities. We have several templates, policy examples, public health data, etc. Next slide. So American Indian cancer data. So we need to start with data when we talk about health issues in our communities. Having accurate data or any data at all, as I'm sure you all know, has been a struggle in Indian country. And this can be due to several reasons, the most common being smaller sample sizes in our communities, and then also the biggest one, which is racial misclassification. The data shown in the chart to the right shows that for American Indian, Alaskan Natives, cancer mortality rates have increased over the past 20 years while decreasing for whites over that same time period. Next slide, please. So this image was taken from our cancer burden booklet. It's specific to American Indian, Alaska Native regions throughout the United States, and it's available on our website. But we also have hard copies too available in our office if any of you would like to receive any after this. So this slide here is specific to the Pacific Coast. Although the Pacific Coast has fewer cancer disparities than other regions, there are still worse rates for some of the top cancers compared to whites. The slide on the right, or the image on the right, shows that liver cancer diagnosis and death is over 2.5 times higher for men and women when compared to whites. And then also stomach cancer is 1.7 times higher for men and 1.9 times higher for women compared to whites. The image on the left shows that the #1 cause of cancer death for men and women is lung cancer, and then for women, the leading cancer diagnosis is breast cancer, and then for men is prostate cancer. Next slide, please. So in order to achieve good health status within our communities, we need health equity, meaning that American Indian and Alaska Native people need to have an opportunity to realize their full health potential. Achieving this equity comes from within our own communities and is created by working toward fair economic, social, and environmental conditions that promote overall well-being. To achieve this health equity, we need to value every person equally with focused and continual efforts to address inequalities we face as Indigenous people, such as historical injustices and the elimination of health and healthcare disparities. Health inequity, meaning just the opposite, which is a disparity based on inequitable, socially determined circumstances such as race, ethnicity, class, and gender. Next slide, please. So our way to explain what we mean when we say equity. So these images are reflective of health equity versus equality. You can see on the top left image, equality just means that everyone has the same bike, whether or not the big bike is either too big or small for them, or even accessible at all. The bottom shows equity, where the bikes fit each person's individual needs. They're able to participate in physical activity equally, and each have an equal opportunity to achieve the best health outcomes. The same can go for the moccasins on the right. To achieve equity, we need to have moccasins that fit our own individual needs and styles. Next slide, please. So as you saw in the previous slides, American Indians face tremendous inequities in our communities. And we believe that we have to work together to overcome these burdens, because we know that American Indians do face large inequities, especially in cancer and other chronic diseases that are related to our individual health behaviors, such as smoking, eating, lack of exercise, and also social determinants of health, which means education, job, safety, etc. American Indians are often on the worst end of every health spectrum. For example, access to healthcare, environmental quality, substance abuse, suicides, and infant mortality. And we all know that we're here because we are resilient people. We're working together to create positive and impactful changes that promote healthy norms in our communities and for our future generations. Next slide. So this is a quote taken from the 2014 MDH Advancing Health Equity Report. It says that health inequities are directly linked to determined and deliberate efforts of U.S. federal, state, and local governments to uproot American Indians from their lands, eradicate their languages, and destroy their ways of life. We like to share this quote because it shows that there is some progress within the State Department in Minnesota when it comes to acknowledging and advancing health equity in Indigenous communities in Minnesota. The State Department acknowledges that the efforts of our governments have greatly benefited one population over another, which has led to our tremendous disparities that we face today within our own communities. Next slide. So although we like to acknowledge that the state recognizes these deliberate efforts of the government, there are government policies and systems that were intentionally created that have had a lasting and negative impact on our communities today that we need to talk about when we talk about the disparities that we face and come up with strategies and solutions to achieve health equity. These are just some of the policies and systems that were put into place. The first one is the Indian Removal Act, which granted unsettled lands in exchange for Indian land. The Dawes Act, which reduced the tribe's ability to live in their traditional ways. It ended communal or community ownership of land and parceled it into pieces, which made it very difficult for American Indians to live off and hunt off the resources that we naturally previously lived off of. The Indian Reorganization Act was intended to end the Dawes Act. It was just a government program that individualized and privatized American Indian lands, which was never an American Indian value to begin with. As you know, we were a community-based people. The Indian Relocation Act intended to encourage American Indians to leave their reservation and learn life, vocational skills, and then also, but really just was designed to assimilate American Indians into Western society. There were several promises that weren't kept from the government to the American Indians, which also has left a lasting impact of mistrust upon our communities and the government. Because of this, hardship fell upon American Indians. They weren't, a lot of them turned to addiction and alcohol abuse to deal with those hardships that they faced. And then within urban communities, American Indians even faced more racial discrimination and segregation. The Indian Religious Freedom Act, although it was in our favor, it wasn't until about 40 years ago that this was passed, and it was designed to protect and preserve the traditional rights and cultural practices for American Indians and Alaska Native communities. The commodity food system has been detrimental to American Indian and Alaska Native health for years and years. We were once a healthy and thriving people because of the natural foods that we were able to hunt and gather off of our own land that we shared. But after we were moved to reservations and served government rations or commodities that consisted of foods high in fat and just very bad for us. And then also commercial tobacco. This led to large numbers of the disparities that we see today, like diabetes, heart disease, cancers, especially lung cancer. The boarding school era was one of the most devastating times for American Indian and Alaska Native people. The abuse that our parents, grandparents, and great-grandparents faced during this time led to tremendous impacts on our people today. Many of these people who experience boarding schools in a negative way have went through a continuous cycle of abuse, addiction, health disparities that has left a lasting impact on our communities. Next slide. So many of the policies and systems that were put in place by the government have an effect on our health behaviors and social and economic behaviors that contribute to our community's health today, as mentioned before. This diagram is from the Minnesota Department of Health's 2014 report on advancing health equity. So it shows that 40% of what impacts our health is social and economic factors, which include unemployment, transportation, poor access to healthcare. And then 30% is health behaviors, which include whether or not we use commercial tobacco, whether we exercise, and choose to eat healthy foods, and so on. Next slide, please. So what are the leading causes? So the 30% is a large part of what impacts our health. So how do we normalize healthy behaviors? We can choose healthier food options, increase screening rates. We can use PSC changes to help support our people when it comes to changing health behaviors, such as providing signage to choose healthy over unhealthy foods, limiting exposure to commercial tobacco, giving employees time during working hours to exercise or receive a screening. And we can, next slide, please. So we have to acknowledge that the 30 and the 40% of what impacts our health stem greatly from trauma, both historical and current. Stresses that we face every day, racism, poverty, systemic inequities, cultural separation, historical genocide and ethnic cleansing, the extermination and repression of our people and our culture. Oppression, unlike other marginalized communities, we still remain on this land base and are regulated in many ways by the federal government, and we have been for over the past 500 years. Next slide, please. So social determinants of health, such as transportation, safety, education, affordable housing, access to healthy foods, determine our ability to achieve health and health equity as individual people and our ability to achieve health equity as a community or a society. This also includes where we live. Is there clean and safe water? Is housing safe? Is it overcrowded? Is there good sanitation? Do we have sustainable income? Because we know that higher income is linked with better health. Do we have access to enough healthy foods? Does our communities offer healthy foods at affordable prices? If we have access to quality education, you know that having a good education and having access to schools can improve several of the social determinants that we face. If we have healthy relationships with friends and families, better support systems and networks are linked with better health. Culture, our customs, traditions, and beliefs can all affect our health as well, or better or worse. Next slide, please. So these community and system level barriers make it difficult for our people to achieve health equity and overall good health. When we are thinking about how to improve health-related outcomes for Indigenous people, we have to be thinking about these huge barriers that impact our survival, and some of these include underfunded urban and tribal healthcare systems, lack of accurate population-specific data, high rates of poverty, poor access to healthcare, lack of culturally competent healthcare providers, limited availability of prevention programs, cancer screenings, and specialist care, especially in rural areas. Next slide, please. So we know that health equity is crucial for the well-being and vibrancy of communities. We know that health is a product of social determinants and health disparities. Health inequities stem from structural racism, discrimination, and poverty. We need solutions that are tribally led, community-based, and rooted in our culture. Next slide, please. So going upstream to advance health equity. Policy system environmental change is an upstream approach to address social determinants of health that we just talked about, chronic disease prevention, and ultimately to advance health equity. ACORNS grantees are a great example of communities that are using an upstream approach to implementing PSC change focused on reducing commercial tobacco use and exposure, promoting physical activity and healthy eating, and also preventing chronic disease along with other health-related risk factors. At ACAF, our upstream approach is offering culturally tailored technical assistance, trainings, education, and also resources to help advance PSC change in our Indigenous communities. Next slide, please. So in order to elevate or make real progress in health equity, we need economic, educational, and political opportunity. As health leaders and health advocates, we need to work with others who are working to increase things like businesses, those working to increase educational levels for our people. We need the capacity to be decision makers for not only ourselves, but in our communities and within our governments as well. That could be tribal or federal governments. We need safe spaces where we live, learn, work, and are able to practice our cultural traditions. We need culturally competent and appropriate healthcare, as we talked about in previous slides. Next slide, please. So it's time for PSE change. Next slide. And you could just go to the next slide. So PSE through an Indigenous lens. PSE change defined. PSE is making changes at the policy systems and or environmental level to affect a broader impact in advancing health and achieving health equity. We know that although important and necessary, investing in only individual behavior change isn't working. We need to start thinking broader about systemic changes within our communities to advance health and achieve health equity for Indigenous communities. Next slide, please. So when we talk about PSE change through an Indigenous lens, we think it's important to also highlight and compare that to the dominant lens, which is linear, compared to how we as Native people view holistic, healthy change. The dominant worldviews are individualism, free market solutions, education for job training, structural discrimination is a thing of the past, mistrust of science and small governments. Next slide. But as Indigenous people, in order to relate PSE concepts to our worldview, as Indigenous people, we need to start by assessing our ways of life. As Natives, our worldview has always been circular or nonlinear when we compare that to the dominant or European worldview. As Indigenous people, we seem to share a similar way in which we view the world. And like I said, that's nonlinear, about balance, connectedness to all living things, and grounded in respect for all life. American Indians are often collective in nature versus individualistic. Our collective culture emphasizes family and work group goals above individual needs or desires, whereas individualism focuses on personal attainment. We know that as American Indian people, one of our strongest assets is our connection to each other, our Mother Earth and culture. By strengthening this connection, we can create opportunities for us to be healthier in our families and our communities. And this is the view that we use to guide our PSE work here at ACAF. Okay, yeah, there we go. So as American Indian Alaska Native people, we walk two paths. The European way that the US was built on, and then the traditional practices and lifestyles that we are raised on as Native people. We know that we need a framework for creating positive change at the community level. We can do this by simply relating the westernized concepts to our Indigenous worldviews. For example, the public health definition of policy is changes in rules that encourage or discourage a certain behavior. But through an Indigenous lens, we can view policy as guiding principles for ways of living, such as respecting our elders, never taking more than what we need, and showing appreciation and respect for all living things. Next slide, please. And the same goes for system change. The public health definition is changes of how things are done at an organization level or setting. But looking at it through an Indigenous lens would be the building blocks of a community that allow it to function as a whole, such as family, clan, band systems, food and medicine systems, and also our tribal government systems. Next slide. So the physical environment of our ancestors can be thought of when thinking about health and wellness in the environment. The public health definition of environmental change is changes in the workplace in the places you live, work, play, shop, and go to school. But through an Indigenous lens, it would be the natural and built world around us and how we interact with it, such as planting gardens, fertilizing the land, harvesting food, our seasonal practices, infrastructure, sidewalks, playgrounds, etc. And just knowing that constantly being in motion all contributed to the wellness of our people. You can go to the next slide. So tribal sovereignty defined, federally recognized tribes are recognized as possessing a certain inherent right of self-government and are entitled to receive certain federal benefits, services, and protections because of their special relationship with the United States. We want to acknowledge that as Native people, we are sovereign and that we can use that as an asset when we are leveraging positive change and health equity in our tribal communities. Tribal sovereignty gives our tribal communities the unique ability to govern our own policies and systems. And Amanda will talk about that later and how we bring positive and effective change at the community level shortly. Next slide. So these are just some examples of PSC changes versus or compared to common approaches in different settings. So in the school setting, a common approach would be teaching a unit on risk factors for smoking, while the PSC approach would be implementing and enforcing no smoking policies during school hours and on school grounds. For the work setting, a common approach would be offering chronic disease prevention trainings for employees once a year, and the PSC approach would be implementing a comprehensive employee wellness initiative that encourages physical activity throughout the workday. In the community setting, a common approach would be organizing walks and runs to raise awareness for heart disease, and a PSE approach would be creating safe, accessible spaces for community members and families to exercise year-round. And with that, I'll turn it over to Amanda to talk about promising practices.
Hello, everyone. For this part of the presentation, I will talk about and present some success stories that we have seen in tribal communities, some in partnership with the American Indian Cancer Foundation, others just examples that we've seen tribal communities implementing PSE change strategies. I just wanted to say thank you, Donis, for going in depth and explaining the importance of health equity and data and some of the significant historical policies, systems, and environments that have played a crucial role in American Indian health and where we're at today. And even though that information is kind of hard to hear, it must be stated, as it was said early on in the presentation, that it needs to be acknowledged. And once it's acknowledged, to be able to really get at the root of positive change and where to move from there. And so this half of the presentation is a little bit more uplifting in how to combat some of those systems that were put in place to basically exterminate American Indian people. Next slide, please. So what we do at the American Indian Cancer Foundation, these are some strategies that we have implemented when working in partnership with tribal communities. I know some of you guys may be representatives of a tribal community and among departmental staff there, but if you are from an outside agency or partner, these are some strategies that can take you a long way. So the first is authentically partnering with American Indian communities to trust the community has the wisdom and solutions to address health disparities which afflict their community. So when we're working in partnership with tribal communities, we don't go in with an agenda saying this is what you need to do to improve the health of your community. We take a lot of time to have conversations with community champions, with community coalitions, with whomever we're working with, to really understand what their health priorities are and what changes they want to see in their community that they know will produce positive health outcomes. Actualizing positive change strategies that are conceived through community member engagement and conversation, advance health equity through PSE change, advocate and apply a health and all policies approach, which we will define here in the next few slides, change organizational practices, and then cultivate community-driven coalitions to influence policy. Next slide, please. So why is that first part of the slide so important is because within tribal communities, there are cultural and social assets. Each tribe's value system and cultural heritage is an asset that holds wisdom within its land, its members and human capital, natural resources, places to put community gardens, indigenous foods that are within that land base, as well as water, political tribal laws and ordinances that promote health, as Donis explained in her sovereignty slide, that tribal communities have the opportunity to leverage that sovereignty in order to create health and wellness policy changes, institutional schools and clinics, social programs that support community health, as well as many others. Next slide, please. This is another tool that is developed just to help kind of decipher PSE change and giving examples of what policy systems and environmental change strategies could be. We create these resources and tailor them dependent on whom we're working with, whether it be through a conversation, and that's one of the products that comes about it. But here's a few that we've designed. So, and then the potential health impact. So the first one is limit distribution of sugar sweetened beverages at tribally sponsored community events and gatherings. This policy actually has just been finalized and will be placed in an employee handbook in a tribal community shortly. They have already started enforcing this policy, and we're just really excited to see where they go, what the positive health impacts and what types of normalcy it creates around sugar sweetened beverages in that community, with the potential impact of decreases in excess morbidity and mortality related to obesity and diet related illness among American Indians. Just as a side note, sugar sweetened beverages is oftentimes the main source of non-nutritional calories that our communities get in a day, just because the amount of things like pop and juice that people are consuming. A systems example is implement preventative screening measures, refer patients to a nutritionist in clinic and hospital settings for people who are pre-diabetic, overweight, or at risk for other chronic diseases. And so instead of just giving them medication and sending them on their way, to really implement a healthy foods plan that will meet the individual needs of that person in order to help some of those chronic diseases, is a systems change that can be implemented in communities. And environmental is provide opportunities to access safe and free water in public areas at community events and convenings. And so this can be supported and sustained through a policy, but just providing water at all community events is a way to ensure that people are being hydrated and have access to a healthy beverage where they might not have that otherwise. Next. So this is health in all policies defined, which is an approach to tribal policy that weighs the potential health impacts of decisions seeking to avoid harmful health impacts and improve community health outcomes. What we really believe in here at the American Indian Cancer Foundation and support and advocate and are willing to help other communities who have the same belief and value system, is that when policies across the tribe are being created and developed, the health impacts of community members should be taken in all of those levels. So as Donis was saying about the social determinants of health, when there's decisions being made about economic enterprises, about schools, about whatever systems that are in any American Indian, Alaska Native community, that among those policies, ordinances, resolutions that are being created, there should be some consideration of what health impacts of the community are going to be. And some of the bylaws in tribal communities among tribal councils or reservation business councils we have actually seen this type of language, not exactly how it's worded here in the mainstream public health way, but in an indigenous way of them stating that the health and well-being of their community members is a priority of theirs, and that within the bylaws, they consider that when making decisions at that level. Next slide, please. And so this is a resource that was taken from the Center of Disease Control, depicting Health and All Policies approach for a urban community to combat obesity within that urban setting. And so those strategies are simple but effective within this urban setting. And at ACAF, we, when we were understanding more about social determinants of health, health equity, we came across this resource and we're like, this is great, but this isn't a reflection of the communities that we see and that we work in and that we're from and where we live. And so this is great, but it's not really translated well through indigenous lenses or for American Indian Alaska Native community. So what we did here, next slide, please, was develop culturally tailored PSD health equity resources for what a tribal community would look like. And so this is a regionally specific resource. And so the strategies within them could be applied across the nation, but we do know and acknowledge that this looks like our region in the Minnesota region with the trees and the green grass, but we have worked with other tribal communities in the Southwest who were interested in partnering with us to create resources that were specific to their communities. And so the community tobacco garden was changed to a place of ceremony. The dance grounds were changed to more of their type of wording. And we do have those available on our website if you're interested in seeing how this resource was translated for another community. But this was the first step in going from the mainstream public health into what it can look like through the indigenous perspective. And next we'll go into some specific PSC examples that are within this resource. Next slide, please. And so this is an up-close shot of the retail convenience store and some tobacco PSC strategies that can be applied there. And so the eliminate the sale of flavored tobacco and e-cigarette products. That would be a policy ordinance on the tribal level to completely eradicate that sale, as well as limit market of commercial tobacco and ensure youth do not have access. The second one, well, they're both policy and environmental changes. So once the policy is created, then you'll see the direct effects as a participant in that built environment, that you'll no longer be able to access e-cigarettes or not be exposed to that type of marketing practice. And again, just touching on the tribal sovereignty, that on the federal level, there are tobacco policies, commercial tobacco policies that are implemented, but they oftentimes don't trickle down to American Indian Alaska Native communities because of our sovereignty and our direct government-to-government relationship with the federal government. And so since those policies aren't automatically woven into our tribal policies, it's really up to the tribal government, to community champions, to health and wellness coalitions to create comprehensive policies that work with their community. So you don't have to go by what the federal government's saying. You have the opportunity to address these things in a way that makes the most sense for your community, and it can be more lenient, it can meet the federal government where they're at, or it can be more aggressive in saying that, you know, this is what we want for our community. So it's definitely an opportunity for tribal communities to make these policies their own. Next slide, please. This is a PSC changed for community dance grounds to use only traditional tobacco and do not allow cigarette smoking. And so working with your, powwow, we have powwow committees here, and saying that, we want to figure out how we give out only traditional tobacco rather than cartons of cigarettes, and then, no cigarette smoking within or around the community dance grounds, because we don't want people exposed to secondhand smoke. Is a policy decision for the sustainability. It's a systems decision to working with that committee and creating that infrastructure to have traditional tobacco as well as get rid of the commercial tobacco, and environmental change where the participants who are attending the powwow will not be exposed to commercial tobacco while they're there. Next slide, please. At the Tribal Council and Government Center, a policy example would be enact tribal tobacco policies that will improve community health. That's a broad example, but as you've seen in the up close insert slides, that it can take shape in any way or form within a tribal community that makes sense. And then prioritize and support positive community health initiatives. And so if there is a health and wellness coalition that is working on tobacco within a community, that the tribal government, that's support from them and saying, not dismantling them and hearing them out. And if they're asking for time on the agenda for the tribal council meeting, and allowing them that time, hearing their perspective. In some tribal communities, we've even seen tribal council members on a health and wellness committee and are really, behind the drive of creating that change within their community. Next slide, please. This is a healthy eating for strong Native communities PSC infographic, health and health policies infographic that was that's closely related to the tobacco one. It's just around healthy eating, and there's a lot more areas depicted in this infographic, but it's pretty much the same messaging and PSC strategies, but related to food. So if you go to the next slide. A strategy that can be implemented within a retail environment would enact a policy requiring healthy advertisement and marketing at checkout area. That is a policy and an environmental change. And so the tactics of marketing unhealthy food to people when they're checking out would be eliminated. And then the environmental change would be stocking it with healthy food. So when people are coming to the end of their visit at the store, they're not seeing unhealthy options that they're picking up and leaving with, and it would be healthy options. And so that might cause them to choose healthier options. And then increase taxes on unhealthy options and decrease taxes on healthy options is a policy change. Next slide, please. Some PSC strategies that can be implemented at a clinic is offer culturally appropriate nutritional counseling, including breastfeeding education, and initiate fruit and vegetable prescription program with vouchers redeemable at stores and farmers market. The first one is more so a systems and environmental change, but could be sustained through a policy to provide patients with that nutritional counseling, as well as getting a mom and baby off to the best start possible by raising awareness of breastfeeding and helping support them through those first stages. Mother's milk is the first indigenous food, and so we know that mothers who breastfeed have significant positive health outcomes for themselves and for their children. We do know that not every mother is able to breastfeed, so we don't try to come down on people or alienate people who can't, but we just like to spread that messaging for those that can. And then the initiate fruit and vegetable prescription program with vouchers redeemable at stores and farmers market. And as also a systems and environmental change, but could be sustained through a policy initiative for the same reasons mentioned above. Next slide, please. Install EBT system to accept SNAP and WIC benefits. That is a systems change to get them implemented within a farmer's market. Waive vendor fees for Indigenous producers and assist with licensure. That is also a systems change that can be implemented within a farmer's market setting. Next slide, please. Tribal Council and Government Center, an overarching PSE change would be applying the health and all policies framework to all decision-making processes, which will trickle down to all aspects and departments within a tribal community. Enact a tribal health and wellness policy. That one's also very broad and has an ability to be tailored to the community in which it's implemented. And support community health and wellness coalition. Our community, that one is more so a systems and a environmental change that you would be able to see and feel within a tribal community. Next slide, please. Dance grounds provide incentives to vendors for offering healthy options and posting nutritional information for all items. That is a systems and environmental change, which could also be supported through policy. And then encouraging bringing healthy dishes to community gatherings. That is an environmental change that participants at that gathering would feel while attending. So, what's next? If you go to the next slide, these are some technical assistance opportunities that the American Indian Cancer Foundation, our team, has with tribal communities, American Indian, Alaska Native organizations, really whoever is interested in doing this PSE change work around these areas. These are some of the offerings that we have. Again, everything is tailored to each community or organization that we work with, and we have pretty concrete examples of what we've done in all of those bullets that we can share if you're interested in learning more. Due to time, I'm going to move on. So, success stories. Next slide, please. This is what we have implemented at the American Indian Cancer Foundation and our healthy eating policy. So we choose Indigenous and local foods as a first choice when serving food. Follow recommendation portion sizes. Choose healthy over less healthy choices. Avoid serving sugar sweetened beverages and disallow employee reimbursement for the purchase of sugar sweetened beverages. This policy has worked within our organization, and it's something that we all adhere to, and has definitely created a normalcy of healthy options within our organization. You hardly see people here drinking like pop on work hours. I mean, it does happen, of course, we're all human, but it's definitely not part of what our normal is, as well as healthier foods you often see within the workplace. Just because that's what we're used to due to this policy. Next slide, please. This is a YouTube video that we have available online that has more information on our health and wellness policy and kind of what it has done for our organization in creating normalcy around healthy foods. But we can move on due to timing. This is an actual vending machine that we have worked with the tribal community to implement a policy change for healthy beverages as well as food choices. As you can see, the differences in healthy food or healthy beverage options has made a significant change within that community. And one thing I do want to highlight is that now this isn't a community setting where youth commonly frequent, that the youth now see the healthy vending machine as a normal part of their everyday life. And when they leave the community or they go into another setting, they see the unhealthy vending machine options, and to them that's not normal, which even though changing your vending machine might seem like a small change, it has significant impacts on creating and normalizing healthy behaviors long term. Next slide, please. These next few slides are other resources that our team has created for culturally tailored materials that, you know, we see oftentimes in mainstream public health, but don't really reflect our own communities and our culture. And so if you go to the next slide, it's just depicting these health data and facts into a culturally tailored resource. And so this one's around breast milk. If you go to the next slide, this is a Healthy Native Foods Toolkit. So if you're interested in implementing a healthy foods policy for community gatherings and events in your community, here's a great place to start on how to initiate that change and what foods are acceptable, what foods are considered healthy, what may not be considered healthy, and that's available. All of these resources are available on our website. If you go to the next slide, we have other webinars like the one recorded today available on our website. So there's a webinar that you might be interested in viewing. We have other departments aside from our prevention and policy team that might be relevant or applicable and something you're interested in. So I encourage you to visit that page to see what webinars are available if you are so interested. And then if you go to the next slide, we have put together a interactive activity to ask you guys to look at some PSE strategies to determine whether or not you think they're PS or E change. And so we're going to ask you to, in the comments section, write whether or not you think that it is a PS.
We can't hear you anymore.
Oh, 1 second. I don't know how to get the chat feature. Okay, I think this might be it. Let me click. Okay, so right here, I think everybody.
Okay, so if you go to the next slide, you can enter whether you think these two strategies are policy, systems, or environmental change, or a combination, or all three. And we'll give you 10 seconds to do so. The first one, childcare sites requiring healthy options for all students, provision of public land for green space, gardens, or farmers markets. Yeah.
Can everyone see the chat? Understand how to use it?
So you can unmute everyone.
Yeah, due to timing, we can just go through what each of these are. So this is 2 examples of policy changes. And so the terminology of requiring and provision make it a policy level change. And so wording and the strategies is very important in order to make clear of what it is that you're trying to accomplish with your PSE strategy. And so if you go to the next slide, becoming a breastfeeding friendly agency and revising organizational procedures to increase cancer screening rates among patient population. These two are system strategies, and so is creating the system within the organization in order to achieve these healthy health and wellness initiatives. And so they can both be sustained through a policy initiative, but how they're worded here, they are systems changes. If you go to the next slide. Presence of healthy food choices at events and vending machines, and provide exercise equipment in community spaces with bikes and canoes. Those are environmental changes, and so you as a participant in those spaces will actually feel those changes by being able to see them and utilize them and have access to them within your environment. Next slide, please. Availability of cessation services to patients or workers. This is a system and environmental change. Offering vouchers at farmers markets is a systems and environmental change as well. Ensuring a clinic goes tobacco free is a policy, systems, and environmental change. Prohibit commercial tobacco use near tribal buildings, schools, clinics, store, community center will also be a policy, systems, and environmental change. The systems piece comes in with creating the infrastructure around the implementation and enforcement of that initiative. Next slide, please. We are here. We know we've come to the end of the presentation time, but we are available for any questions that you may have. Otherwise, our contact information is on the last slide.
Yeah, if anybody has any questions, feel free to either type them into the chat or you can unmute yourself. And then also before we go, we have a little evaluation poll. So maybe we'll just give it like a minute or so for any questions, and then we'll put out the poll. And if everybody could just answer that. Call it a day. Thank you so much, Donis and Amanda.
Yeah, of course. We're looking forward to the next one.
So they're going to actually be doing 2 more webinars with us throughout the summer. The next one is going to be about gauging community readiness and also trying to engage your community in different projects. And then the final one will be on the burden of cancer and commercial tobacco and chronic disease, and also I believe policy enforcement. Is that correct?
Yep.
So once you've made those policies or those wellness policies, you know, that's one step of it, but then the next step would be implementing and enforcing. So
we got a comment from Adriana Atchison in Tule River. She said, great presentation. From Miss Jennifer Gagliano in Greenville, that she said, great information. Thank you so much.
Okay, so I'll go ahead and put out the poll. It's just a quick 5 questions, and then if when you're done, you can go and we'll sign off. Thank you.
Oh, right there.
Thank you.
Thank you, everybody.
So the poll is out.
Should we? Yeah, I just don't know. Let me see here. All right. I think we.
If you guys need to sign off.
Okay.
Just type in your.
All right, and then would you be able to share those results with us?
Absolutely.
Awesome. Great. Thank you so much.
You're welcome. Do you mind?
Enjoy the rest of your day, everybody.
Thanks. Could you write your contact information in the chat?
Oh, sorry. Yep.